Good morning, Facebook Live. My name is Lisa Hartman. I am a physician assistant practicing in New York City, specializing in cosmetic dermatology and laser treatments. Today, I'm here to discuss with you a new and improved way of treating a lot of your skin woes called the Nautilus by Ellipse. It hails from Norway, Sweden, and Denmark. It's very popular outside of the United States, but recently gained FDA clearance to treat some of these skin conditions here. We have vascular lesions, facial telangiectasias, diffuse redness and pigmentation from sun damage, acne scarring, acne spots, active acne, scars, whether they're acne scars or surgical scars, hair removal, the bad one, toenail fungus, as well as leg veins. As you can see here in this picture, we have a Visia skin imaging software that's showing a before and an after a photofacial treatment done by this wonderful device. As you can see here, the patient has some diffuse redness, solar damage. After just one treatment, you can see pretty much full clearance of those skin woes. Here's another image before and after a single treatment with one of the pulse light technologies. You can see some clearance of the solar keratoses, some facial telangiectasias around her eyes and around her nose. Again, solar clearance. This is also with one of the pulse light treatments. Here we have some diffuse redness cleared afterwards. Looks like just a single treatment as well. Again, we have port wine stains that we can treat. As you can see here, this is a single treatment with the photofacial treatment. Down here, we have two different light therapies with different wavelengths treating diffuse redness as well as diffuse pigmentation. So we're in the day and age of combination treatments to really treat some of the skin issues that we have. Back in the day, we used to, pound the skin with a very heavy-duty laser or photofacial treatments that would cause a lot of downtime. And one of the things the reasons that this particular device speaks to me is that a lot of my patients come in and their biggest concern is downtime. So this particular device selectively filters out some of the unwanted chromophores in the skin. So we can actively say, I want this device to just treat reds today, which means it's not going to treat any of the other pigment issues in the skin. Or I want this device to just treat browns today, so it's going to treat some sun damage. And one of the other things that's really nice about it is our skin is made up of roughly 70% water. So when you have that much water in the skin and you're taking a device that's heating up tissue, and you heat up the water, that's going to cause some erythema or redness, some swelling, and definitely much more downtime. The great thing about the Nautilus by Ellipse device is that with the photofacial treatments that we can deliver do not target water. So what that means for our clients is much less downtime without compromising efficacy. As you can see here, again, a close-up of some facial telangiectasias being treated with both two different hand pieces, one targeting some browns and one targeting some reds for us. Scars, acne, hair removal. Hair removal takes us about 10 to 15 minutes to clear a full back. On average, patients need between 6 and 8 sessions for full clearance. One of the great things I love about this device is it also utilizes an ND-YAG. An ND-YAG is a laser that is used for treating blood vessels. And previous to now, we were very nervous about treating blood vessels around the eyes. This device offers a safe and effective means of treating those blood vessels for us, as you can see here before and after. Again, we have some spider veins on the legs. This is all with the ND-YAG treatment, roughly 90 days after treatment. There's that toenail fungus again. And then for a lot of our little guys that come in that are born with port wine stains or cherry angiomas, that, again, because this device selectively filters out the wavelengths, we can target what we want it to target, causing much less discomfort for these little guys to treat some of these unsightly blood vessels. And then this is what we have our before and after of a photofacial frax combination treatment where we can really, well, basically this one was just frax, which we're going to kind of demonstrate for you in a bit here. But if we were to do a combination treatment on this patient, again, combination therapies are really the way of the future. You can see she did get a profound amount of skin tightening. If we were to go back over this treatment with, say, one of the photofacial type wavelengths, we can clear up some of her redness and really help overall improve her tone, texture, and quality of her skin. So now let's go meet our patient who's been waiting in the back for us. All right, guys, this is Carrie. She's come in today for a little bit of a combination treatment with our photofacial as well as our frax. So our frax treatment is going to be more of a resurfacing of fine lines, wrinkles, closing off small pores, just generally speaking, clear up the overall surface and textural irregularities in the skin. Whereas the photofacial, which is going to be the first portion of this, is going to be the intense flashing light that you're going to see. That's going to help clear up some of her redness, some of her pigmentation. It brings that sort of those things to the surface of the skin. It feels pretty comfortable, kind of like a warm flashing light on the skin. Some people describe it as a rubber band snapping. Do you have any questions before we begin?
Not at all.
No? Okay, go ahead and close the door. Safety first, we must wear goggles to protect our retinas.
So what specific kind of treatment is this patient going to get today?
So today we're going to, she has some diffuse pigment in her skin. She doesn't sit in the sun, but most of our sun damage from our early 20s and 30s comes out when we get a little bit older. So she has a bit more of the freckly type skin, which freckles are actually in. But what we would love to do is kind of clear up some of the areas where she has, you know, a collimated area of blood vessels around her nose, on her forehead here. You can, if you were to get really closely, you can see the telangiectasias and the sunspots. So we're going to treat her mostly up front for the sun damage, and then we're going to do a couple flashes to treat the diffuse redness. Typically speaking, there's not much downtime with this particular procedure. She'll be a little bit flushed and a little bit red right afterwards, but it's generally because it does selectively filter out all those unwanted wavelengths of light. We don't have much downtime with it. And then after we're done with that, we're going to go over top of her skin with a laser. So the first portion is not laser, it's an intense pulse light or a selective waveband light, which the way to think of it is like a flashlight or a light bulb. And the light bulb, when you turn it on, the light diffuses. A laser is unidirectional. It's just one wavelength. So we're going to be using the laser afterwards it's a non-ablative laser that's going to basically sort of mow the surface of the skin, like mowing the lawn. We're going to resurface the outermost layers of the skin. She's going to get great skin rejuvenation with it. It's going to help with those fine lines and wrinkles we start to see in our late 20s, early 30s. Namely around the eyes, shrinking the pores across the malar surface of the skin. It's also going to help, it will also help with pigment, but again, like I said before, the best way to approach most of our skin treatments is a combination therapy. As we advance in time, we've learned which wavelength is the best of the best to treat reds or browns or purples or tattoos, for example. There's several different wavelengths that we use to selectively target a given chromophore in the skin. So combination therapy is really just the best way to kind of treat many different things. And she has a few different concerns that we discussed earlier that we're going to work on.
Did she have to do anything specific to prepare her skin for this treatment?
Yes. So prior to you guys entering the room with me, we had her numbing with a topical lidocaine tetracrine cream for about 20-30 minutes. It pretty much numbs the skin to where she should be very comfortable during this treatment. I usually say the scariest thing is the light kind of flashing in your face because it is a little bit alarming, but it is a very comfortable treatment. The frax portion of the treatment, some people are, depending on the energy, the nice thing about the frax is that we can completely jailbreak and control the temperature setting, the energy, the fluence, how much power is being delivered to the skin. So if a patient is uncomfortable, we can dial it down. Generally speaking, we want to give a more modest treatment because patients come in. This is a completely a cash pay business, so we don't necessarily need these treatments. We want them, but we want our patients to feel comfortable with least side effects and risk to having long-term downtime. But the frax basically feels, it can feel like little tiny prickles in the skin as it travels across the skin. It's a general roller. You'll see in a second.
So none of it hurts then? It's more just like prickly?
I wouldn't say that it doesn't hurt. So we do a couple different passes on the skin. As the skin sort of starts to heat up, you will feel it a bit more. But generally speaking, patients are very comfortable. It's a forgettable kind of pain. Usually by the time people get home, most of their redness that they have post-procedure is pretty much gone. But I always watch my patient's face, listen to what they say, and if they're too uncomfortable, I just have them raise their hand, and then we turn things down, wait. There's ways to get through it.
Wonderful.
Any other questions?
Not for the time being, but I'm sure our readers will have a lot to say.
Perfect. So let's go ahead and get her skin prepped. The first thing I'm going to do is add a bit of cooling, a cooling medium to her skin, which is just like a water-based lubricant. One of the other beautiful things about this device is I've used a lot of different selective wave bands, lasers, light-based therapies, and IPL is what most people term it as over the years. The Nautilus does not require me to super cool the skin, and I can treat skin types 1 through 6 safely and effectively because it does filter out those unwanted targeted wavelengths in the tissue. So this opens up the ability for people of darker skin types to have treatments with great results. So far, so good.
Of our readers are wondering how much this costs.
Treatments range. Well, combination therapies really depends on how many treatments are necessary. For her, we're doing a combination of a frax laser as well as a photofacial. On average, photofacials are around $500 to $750 per treatment. In my practice, when we do combination therapies where we're doing more than one sort of device at the same time, we do sort of package things in. So a treatment like this might cost upwards of $1,500. If you were to do them singly, it might be more like $1,000 and then $500 or $750, depending. And usually is more beneficial for a patient to do them at the same time. But the lighter skin types are the safer skin types to treat a little bit more aggressively. The darker your skin type is, typically we have to make sure that we're protecting the melanocytes and the epidermis so that we don't cause scarring or unwanted long-term sequelae. A little cold gel here. The first thing I'm going to do is give her a test spot. So this is the flashing light that you're going to see in the air, okay? And the first thing I'm going to do is a test spot right around your nose. 1, 2, 3 pulse. How is that? Not so bad?
Not bad.
Tolerable? Good. Here we go. And what we should see when we're done with the photofacial portion is her redness and her pigment will become more apparent without the surrounding tissue being very red. Because again, we're not targeting water, we're targeting whatever it is we're treating. And for today, mostly we're treating her pigment. Still doing okay?
Mm-hmm.
We have her on a pretty modest setting, and she's still pretty comfortable. We're about 2 full power settings higher than average. And you only need to do 1 pass. Still doing okay?
Mm-hmm. So can I ask a question?
Sure, go ahead.
So that pass that you just did
Mhm.
basically took care care of that entire side of your face.
Absolutely. If you look at the applicator, I've used a lot of different photofacial devices over the years. This is almost double the size. So for a patient coming in on their lunchtime, the entire procedure, I know we're going a little slower today because we're explaining this to you guys, but the entire procedure can be in and out in about 10-15 minutes. So that makes it really nice to have this procedure done on your lunchtime. All right, you ready? Same thing here, pulse. The other really nice thing about this device that I don't see with other devices, in the summertime I get on the subway and I see many young girls that have had, photofacials or laser hair removal, and they have these little spots where they've had a bit of a laser burn or flashback from the flash lamp on the device. If you notice, I can hang this off the side of her face and flash it, and I don't have to worry about the portion that's not touching her skin causing what we call a laser burn on her skin. This is the only device I've ever used that doesn't cause that, and it's because they selectively filter out those unwanted wavelengths of light in the skin. It's a really, really nice safety feature. Back to this side. The other nice thing about this large handpiece is that it allows us to not only treat much quicker, but when you have a larger surface area, say the chest for the décolleté for photorejuvenation, a whole chest will take me roughly 10 minutes to treat. Most devices, like I said, are about half the size of that.
So a couple of our readers have questions about this device. One woman is asking if this can help eliminate freckles, and another one is asking if it can help with wrinkles.
So yes, not so much with wrinkles for the photofacial portion of it, because it's not selectively heating up that water. So you really do need to heat up water to treat wrinkles, because that's basically what we're targeting when we are doing a lot of the different laser treatments. The non-ablative laser treatments heat up water and sort of stimulate our fibroblast cells to make some more collagen. And collagen, as we know, is the structural protein in the skin that is going to increase skin elasticity, collagen and elastin. So when you heat up water, you do that. But this one particularly, the photofacial portion of it does not touch water, as some other devices do. But that's what makes it safer in our darker skin types for treating. So, but the Frax is a laser, and the Frax is meant to treat fine lines and wrinkles. That's also why for her I'm doing a photofacial and a combination with the Frax to target the pigment, the freckles, because she doesn't really have a lot of solar damage. She just has, some diffuse freckling. They're cute, but she told me she wanted to remove them. So again, there's no one device that treats everything perfectly without increasing downtime for our patients. And the more things you treat with one device, you typically compromise the ability to treat everything. It might treat one thing very well.
Someone else is asking about acne scars.
Absolutely.
Does this help
So
with acne
scars, the way I would treat an acne scar is first I would make sure that there's no active acne. So remember, one of the hand pieces on this device selectively targets redness. And by doing so, it also turns off some of those sebum or oil-producing glands. I would treat with that first, and then in a combination therapy, go over top of it with the Frax. The Frax, again, is for resurfacing. So in order to build some acne scars are slightly indented, some are slightly raised. So we're resurfacing the skin to sort of plane it nice and flat. So it does that portion of it, targeting the redness in the whether it's indented or raised, and then also regenerating a little bit of collagen beneath the surface of the skin.
And how many sessions does a typical patient need?
Well, it depends on what we're targeting. If we're targeting pigment, most of my patients were doing roughly about 2 treatments. For her, I would say 2 treatments should give her probably 95% clearance where she's really happy with it. And then on average, my patients might do a refresher touch-up treatment once a year. But for acne scarring, it really depends on the patient. Everyone's different in terms of how much scarring they have, where it's located. If they have active acne, I might combine them with antibiotics to help clear them out, versus Kenalog injections to reduce the size of cysts. It really just depends on the patient. That's why we have patients that call and ask questions about the cost of these procedures, and we really need to see you in person to adequately determine how many treatments you're going to need in total and what your particular skin complaints are. All right, so now we're going to make a little bit of a shift over to our fracks.
I'd like to check in with the patient now. How are you feeling?
Feeling great. There was no discomfort at all. The only thing that is really just startles you is the light,
Exactly what I
and
said.
you're waiting for something to come after that, and there was nothing at all. So it was really.
So if you look at her skin now, she's mildly flushed, and her pigment is actually becoming a little bit darker. It looks kind of peppered if you look really closely, and that's really what we want to see. That's sort of a clinical endpoint for the treatment that we just treated with. And now we're going to move on to the fracks. Now the fracks is a little bit more uncomfortable. Our derivative and tactile sense, or our pain receptors, are very superficial in the skin, and this is treating a little bit more superficially to plane down the surface of the skin. But we did prep her with that 23/7 lidocaine tetracaine, and she will let us know how comfortable she is throughout. Okay?
Wonderful.
Let me just switch this over. Big breaths. Do you want to give her one of the balls there? For the shower?
All right, I'm just going to place a stress ball in your hand if you want to give that a few squeezes.
After giving birth, you really can't handle anything.
One of the other nice things about this device, and I've used several different fractionated wavelength technologies over the years, is that it's not nearly as cumbersome as some of the other devices on the market. It is very lightweight, user-friendly. I'm small, I have small hands, and for me that's incredibly important when I'm trying to treat my patient and make them comfortable. All right, you ready here?
One of our readers is wondering if the Fraxel will help with the 11 lines between brows.
Any type of skin resurfacing device that is shaving down tissue, sort of planing tissue, will absolutely help. This is the Frax 1550. Fraxel is a name brand. I like to educate my patients. There's a lot of different types of procedures out there that people just sort of use the umbrella term Fraxel as they use the umbrella term IPL. But you really want to, a lot of people don't, general population doesn't understand the differences in the different devices, and they're really targeted to us practitioners, and it's meant for us to understand why this 1550 handpiece might be slightly better than, say, an older technology. What these companies have done, and I leave it up to the laser physicists who really know the science behind this, but they basically provide a more comfortable treatment for our patients by getting rid of some of the unwanted heating up of tissue. And you'll see during this procedure she's going to be very comfortable. She's going to be mildly red post-treatment. One of the, you're speaking about Fraxel, and I'm not going to speak negatively about Fraxel because I do love Fraxel as a device. I had it for many years. I do not have it anymore. As we progress in time, technologies advance, and usually what that means is clinical improvement and comfortability for our clients. So this is the newest, this is actually the first handpiece in the country. I'm the first one to operate it, which is pretty exciting. But it's a 1550 nanometer wavelength diode laser. It's an actual laser, not an intense pulse light treatment. Any other questions before we get started?
Nope.
All right.
I think we're good to go.
So turn this way. This has a roller device that I basically gently roll over the patient's skin. And if you get closely, you can see there's a red light that acts as a guide for me. Here we go, sweetie. And you can hear it makes little beeps. If I go too fast, it'll start to beep at me, telling me I'm going too fast, which is really nice. Gentle passes across the tissue. And we generally do a cross-hatching pattern with most of our lasers so that we don't leave unwanted streaking. How are you doing, sweetie?
I don't feel anything.
Great. Some powerful numbing cream.
What does it feel like to you?
There's a little, what is that air that's blowing?
It's
Is
a
it
little
like a
bit of
little
air.
fan?
Mm-hmm.
So that's all you really feel.
Like
You
a
just,
skin
Gust
cooling
of
device.
air.
yeah. Actually kind of feels like a little bit of a massage on the face.
I like that.
Sounds very relaxing.
And then when there's certain areas that we want to target, so typically speaking, we'll do about 3 to 4 passes. The more photo-aged and the more wrinkled a person is, the more deep the acne scars are, we will target the areas of concern a little bit more aggressively. So that means that we can get a little bit more downtime on those areas. But if we're generally just kind of doing more of a photo rejuvenation and a skin rejuvenation resurfacing treatment, we'll just cross-hatch the tissue in an even pattern all the way around.
So you go over the entire surface
Yep,
of the
the
face.
entire surface of the skin. Some patients that, come into my practice and are on, a budget, but they really do want to see the benefits of some acne scarring improvements, or they have, most of their skin is really clear and free of sun damage, I might suggest targeted treatments. One of the more common concerning areas for patients are around the eyes, in between brows, nasolabial folds. So we will break down treatments for them based on those areas to make it a little bit more budget friendly.
The reader is wondering if this can also be used for dark under eye circles and puffiness.
I would not say so, no. Dark under eye circles and puffiness are really caused by a multitude of things. It can be, for some individuals, vascular. And then what happens is, not getting enough sleep and stress and poor diet, lack of drinking water, those little blood vessels around our eyes can leak some of their fluid into the surrounding tissue and cause a little bit of hemosiderin deposit, which is really just a pigment found in blood. And that hemosiderin deposit can sit there and appear to look stained under the skin, versus lighter skinned individuals being able to just see the bluish hue of the blood vessels through the tissue. So laser wouldn't really treat the latter of the two. If someone had some collective sun damage around the eyes, then yes, laser can brighten the skin and treat that area. But generally speaking, for patients that have some darkening of the tissue around their eyes, and a lot of times it's shadowing from loss of volume. A lot of times I'll treat their tear trough area with dermal fillers. Still doing okay?
Mm-hmm. Now you're saying that I will need another treatment after this, a follow-up.
Mm-hmm.
How long after?
Roughly about 4 weeks on average. Sometimes if patients have, a big event that they're trying to prepare for, a wedding that's very popular in my practice, I would suggest seeing them for a follow-up 1 week post-treatment. And depending on how their skin has recovered and responded to the first treatment, I may bring them a little bit closer together or push them further apart, depending on how their skin has responded. So maybe turn this way for me. So you can see she's a little bit flushed from side to side. Ready?
So then what you're saying is after I do the follow-up for the 4 weeks, sorry, I'll be talking right
You're
now.
good.
Then I'm pretty much good for 6 to 8 months.
After you've done the full series of treatments?
Correct.
Yes.
So the maintenance.
The maintenance is as good as you protect your skin. So
Right.
in my practice, we don't really believe in a lot of makeup, but we do strongly believe in sunblocks that have a little tint to them. So the more you're in daily wear sunblock, even indoors, a lot of patients don't really understand why they need to wear sunblock indoors, but you get UVA and UVB radiation through the windows, and there's a very famous dermatology picture that shows a truck driver who never wore sunblock, and the sun damage from the left to the right side of his face was so profound, it sort of, I think, made a lot of people start wearing sunblock. Relax your face. And has developed an understanding of the importance of sunblock.
A reader is curious, does this even the skin tone itself?
Yes, absolutely. So again, with the photofacial portion, the selective waveband light treatments will bring out any unwanted pigments, be it browns or reds, which will essentially and effectively treat pigment irregularities in the skin. Whereas this portion is the Frax treatment, which is resurfacing the outermost layers of the tissue. Again, like planing down, the best way to really think of it is like mowing the lawn. We're tilling the surface of the tissue. You do get some pigments, but again, some pigment dives deep into the skin, and you need to bring it out with a photofacial type treatment, which is why I really truly believe in combining these treatments for best results in someone that has more sun damaged skin. If you have pretty clean skin and don't really have a lot of pigment or redness in the skin, and you're just looking for rejuvenation of the skin and sort of preventative maintenance treatments, the Frax is a great option for that.
What about lines around the outside of the mouth? Another reader wants to know what you'd recommend for this. Would it be a procedure similar to this or something different?
It depends on the lines. If the lines are etched into the skin, where when you're at rest you see a break in the skin, then I would typically recommend laser resurfacing. However, if the lines are more shadows and folds, typically that is due to volume loss, and I do a lot of dermal fillers in my practice. I think that there's no one treatment on the market cosmetically that is going to make everyone completely happy, and it's usually about a combination of treatments. I would say my average patient does a little bit of skin resurfacing. My general principle is if the skin canvas isn't free and clear and clean, it doesn't matter how many dermal fillers you place or how much Botox you use in the skin, you're not going to have a clean canvas to portray. Still doing okay?
Mm-hmm.
So when will the patient begin to start noticing changes? About how long does that take?
About 2 to 3 days. The patient will, usually you will feel kind of sandpapery, like coarse sandpaper later today. Tomorrow it'll feel more like fine grained sandpaper, and then it'll go smooth. So usually about 3 days of just feeling like a little rough and maybe a little bit dry in texture. And then you don't really notice the depixelating of the skin. It doesn't slough and peel very aggressively when you do a more modest treatment. If you do a really heavy treatment, then you might notice some of the skin sort of sloughing about 3 days out. But after it's fully done recovering, usually under a week for most people, you will start to see the overall brightness and complexion changes on the skin.
Now, can you work out your daily routine after this? Or?
Absolutely. Normal routine would be to keep your face cleansed after the treatment, and then if you're going to go to the gym, I would just avoid saunas, jacuzzis, hot tubs, anything that's going to heat up the skin, especially.
But you can sweat.
Absolutely. But keep in mind that when you sweat and your blood pressure is high, you are dilating those blood vessels in the skin, and if we're treating some of those blood vessels, you're kind of working against your treatment. So I would generally, and the same goes with most treatments we do, dermal fillers, neurotoxins. We don't really want to spread things beyond the point of injection site, and we don't want to dilate those blood vessels, especially with hair removal, because that's what the target is with the device, is treating that area.
Is there anything else that she cannot do, absolutely not do after the treatment?
No exfoliation, no chemical peels. Generally speaking, you want to treat your skin like a newborn baby on the beach. You want to make sure you're wearing sunblock. Exfoliation can just increase downtime and cause more skin irritation. We generally recommend, I have over-the-counter skincare recommendations such as like Cetaphil or CeraVe for gentle cleansing. Post-procedure, if people have had cold sores in the past, I would generally give them a prophylactic Valtrex treatment or a cyclovir treatment. because just like sun exposure, heat exposure, laser and light exposure can cause one of those to sort of come out. Most patients can feel the prodromal effect prior to it actually happening, so they would know if they're going to get one.
That's
But it
interesting.
is one of the things that we forewarn our patients about and send them away with a prescription. In reality, we rarely see it happen, but it's because we have our hands on our patients so much.
Very hands-on.
Yeah, very
procedure.
hands-on. When it comes to post-procedure, it's just really don't pick. I tell my patients, don't look at it so much. Give it a couple days to recover and heal and mend, and just to be very protective of it. Sunblock is going to be your key. My general rule is 45 and above, and I prefer zinc and titanium physical blockers to chemical blockers. For some individuals, myself included, chemical blockers are a little irritating to my skin. And for those melasma types, chemical blockers have shown some evidence of converting to estrogen in the skin. So for patients that suffer from melasma, which we assume to be a more estrogenic condition, we wouldn't want to be putting something on our skin that's going to convert to melasma. So we, for the most part, carry physical UV blockers in our practice and recommend those to our patients afterwards. Okay,
Wonderful.
any other questions?
Just wanted to check in with the patient again. How are you feeling?
I'm feeling
now
great.
That, the process is over. Feel good? No
Wonderful.
pain?
No pain, not one bit. Yeah,
No discomfort?
not at all.
She had numbing cream on for about 30 minutes prior to the procedure, and it's a very strong numbing cream. It's much stronger than just Emla. It's very expensive numbing cream, but it allows me to
It's worth it.
comfortably and safely treat the patient and give them really what they came in here for.
And how long does she have to wait now that the procedure is over before she can kind of get back into the swing of things, go back
her
out
skin
in the
is
world?
pretty. You can see all the little speckled spots are a bit darker. She's not that red right now. I would have her apply a little bit of sunblock. She can put makeup right over top of that and go right back about normal business.
Oh, okay. Fantastic. Well, a lot of our readers are definitely very interested in your procedure. They're wanting to know your name, location, and website. If you wouldn't mind sharing that once more.
My
with
name
the
is
readers.
Lisa Hartman. I am a cosmetic dermatology and laser specialist PA here in New York City. Jacqueline Rowan right here. She's going to be the person
Hi.
you'll talk to when you call.
Call us anytime.
Our office number is 212-575-1457. We're located at 65th and Park Avenue, 44 East 65th on New York's Upper East Side. And our website is www.sovous.com.
Fabulous.
All right. Any other questions?
Well, one reader was wondering if we could see more before and after, so if we could just possibly revisit those images that we saw at the beginning of the video. Some may just be tuning in right now.
Absolutely. I'm just going to put a little cream on her face before we settle out.
Fabulous.
You want to go prep those? Yep. This is just a skin healing barrier cream.
This is kind of like an end coat then.
It just kind of puts a barrier between her skin and the outside world. Anytime we do any type of laser treatment, whether skin sloughing, we always worry about pollution, environmental.
Especially in the New York area.
Of course. This is a non-ablative treatment, so we don't worry. Non-ablative basically means no cuts in the skin. But ablative treatments put tiny little cuts in the skin, so we worry a bit more, and we might use more emollient creams like an Aquaphor base to add an extra protective layer. All right. So there's a couple different. Anything particular that people want to see if they're coming out?
I guess just before and after snapshots of different kinds of treatment.
So they got the name right. Nordalis basically means northern lights, and the initial portion of this device was a light-based treatment, which is the first portion of what we did on her today. So let me just get to
close-up shots then.
So patients always forget about their hands, neck, and décolleté, so we can photo rejuvenate and get rid of some unwanted pigmentary issues in the skin. This would be more with the photofacial type treatments. textural irregularities, epidermal melasma. As you can see, this patient had really, I mean, the lighting's slightly different from picture to picture, but she had pretty significant melasma and was able to clear that nicely. And this would be more with the photofacial portion. So again, with melasma, and melasma is a concerning treatment for most patients because anytime you heat up the tissue, we run the risk of causing the melasma to get worse. And the fact that this does not target water, we don't heat up the tissue and cause that erythema or redness and downtime. So it provides a more safer treatment without compromising the overall efficacy. So as you can see here, a patient had sort of a combination of some diffuse redness. If you look really closely, there's a lot of broken capillaries there across the bridge of his nose. This is just after one treatment. In my opinion, another treatment would do much nicer at cleaning up some of his redness, but that's a pretty big difference. Most of his pigment is gone before and after.
So patients can typically expect to see these kinds of results in then a
Absolutely.
few days then?
Well, typically, so for something like this, with the downtime of being about 3 days of basically sloughing of any tissue, but it would be microscopic sloughing, so not real downtime, within a week you'd see improvement. For acne, acne again is a relapsing and remitting thing for most people. When it comes to, there are different components to acne, whether it's bacterial, hormonal, it's usually a combination, sebum production. We're targeting two things with this. We're targeting the redness in the lesions themselves, and we're targeting the sebum production and slightly killing off the bacteria. So one of the recommendations, for a patient like this who has really large cysts, I might do a couple of injections of a Kenalog treatment to get rid of the cyst itself and then go over it with the photofacial treatment to reduce the sebum production and kill off the P. acnease. Generally speaking, you would need about 3 treatments for acne. An older patient. As you can see, even though we're targeting the acne, before she had some broken capillaries around her nose, and you can see one of them still slightly healing there. This is probably about a week after her final treatment. And then scars, again, we treat acne scars, we treat surgical scars pretty nicely. Because we're targeting out redness, it's only targeting the areas that are red in the tissue. So all these are just one treatment.
Wow, just one treatment. That's pretty incredible.
Hair removal. As you can see there, before and after. More hair removal.
There's a lot of things
No,
this device can do.
Absolutely. In my practice, I've been practicing for about 7 years, but I just opened in this location, and when I left the practice that I was at, I had about 8 different devices. And in searching for a new device, I really wanted to find something that could treat the bulk of the whole of my patients. These devices are very expensive for us as providers to purchase, and finding a device that allows me to treat all the things that I used to treat with my 8 different other very cumbersome devices. It's actually a really nice and unique feature that they were able to combine 3 of my favorite different technologies in one single unit.
Wow.
And I think I speak for more than just myself when I talk about other practitioners. Would love to have one clunky piece of machinery in our office that can treat a little bit of everything. Over time, what we've done is, since science and technology have advanced, we've been able to make each wavelength slightly better and listen to our patients, listen to the providers across the country and across the world at which wavelength is the best for treating each individual skin concern. So as we advance, a lot of the older technologies are becoming obsolete because this is the first one in the country to be able to utilize some of these wavelengths at lesser downtime for our patients.
So what would you tell a prospective patient who is interested in getting this kind of treatment? What is some advice that you give to them?
Usually I would tell people, if you are using any antibiotics currently, to give us a call and let us know prior to, because certain antibiotics are photosensitive, so I wouldn't have you using those prior to a treatment. There are some different schools of thought in terms of Retin-A and skin exfoliations pre-procedure that I would typically tell patients to go off of, just because I'm learning your skin for the first time, and if you're already actively exfoliating and we're doing an exfoliative treatment, it could increase downtime. So I would typically say, to stop those. Can you think of anything else we typically tell our patients? It's really about coming in for your consultation, understanding what your individual skin concerns are. We treat our patients as a whole here, so what you might think is the best for you, we might feel differently, and it's an open room, an open discussion, and I always say I'm here every day. Here's a couple more treatments. It does a really nice job for pediatric patients. Port wine stains. Port wine stains show up differently on different skin types, so this one's a bit more brown.
And what would you say is the best before and after that would be closest to what our patient today?
So we did a little bit
received?
of this. We did a little
Okay.
bit of treating redness. I selectively, she didn't really have a ton of broken capillaries, but we did use the wavelength for treating redness in her skin because she has a little bit of an underlying ruddy complexion.
Okay, so a
Which
little
will
bit of
hopefully
that
clear.
too.
And then the other picture was the one that I showed. Let me see if I can get to it. It's not in this book, but I showed it on the computer screen earlier. It's more for fine lines and wrinkles. We'd have to go back to that to show you. Yeah, it would be up there on the computer if you wanted to look at that again.
Perfect. Well, thank you again so much for your time. Thank you to our lovely patient for letting us in. Thank you for your time. Is there anything else that you'd like to add before we sign off?
I don't think so.
Wonderful. Well,
Give us a visit.
Thanks for having us.
Thanks for having us.
Thanks for stopping
Hope it was
by.
educational, guys.
thank you for watching.